All right, we're going to also focus at AWANI about health sector where cardiovascular disease are on the rise in Malaysia, driven by factors such as lifestyle changes, dietary habits and aging population. Managing this disease effectively is crucial for improving public health outcomes. Additionally, Penang has emerged as a leading medical tourism hub, attracting international patients with its advanced healthcare services and facilities. To provide deeper insights into these issues, we are honoured to have Mr. Anwar Anis, the Executive Director of Northern Heart Hospital, with us. I want to say thank you very much, Mr. Anwar Anis, the Pengarah Eksekutif Northern Heart Hospital. I want to say thank you very much. Firstly, we want to take a look at how can actually Malaysia leverage big data and AI to predict and prevent cardiovascular disease, and what are the potential ethical implications of such technologies?
Assalamualaikum, Nina, and a very good morning to everyone. Firstly, thank you for having me on this morning. I think in terms of AI and big data, like it or not, it's actually already in use, especially in cardiovascular. As many of us probably know, the Apple Watch itself has got ECG capabilities and so on. And with that, it already leverages on AI and big data, whether we know it or we don't. So our doctors in our hospitals are already used to having their patients use devices like the Apple Watch or another device called Cardia and so on, which already relies heavily on big data. Now, I suppose the concern sometimes is, in terms of big data, is the data localized to Asian population, especially Malaysia, given its diverse demographic background, different races, because diseases are different for different races as well. So the danger is that the data may not be localized, but certainly it's already there and it's already being used quite regularly, I would say, especially in cardiovascular health, because of the variables that are there in the market.
And looking at Penang's medical tourism sector, how can this sector integrate personalized medicine and genomics to cater to high-end international patients, and what challenges might arise from such integration?
Well, there are a couple of examples. Actually, pharmacogenetics is something that's already in the market. Doctors do use it. This is because by doing a genomic or a pharmacogenetic study on a patient, you would know what medicines are suitable. Some medicines may not work for certain patients. And previously, maybe patients may be taking medications for 4 or 5 years, not knowing that the medications actually don't suit them genetically. So in Penang, there are efforts, both by the state government, as well as Penang Medical Tourism and the private sector in Penang, to bring in these technologies and make it more commonplace. So we are in conversation with certain parties. Northern Heart Hospital actually is less than 2 months old, so we are working towards integrating some of these advanced pharmacogenetic studies within the hospital to use them, like I said, hopefully so that patients don't take medications worth thousands of ringgit over many, in a year, it could be tens of thousands of ringgit, but the medication is not being effective for them. So by introducing pharmacogenetics and other genetic studies, we hope to make it more effective for the patient, more cost effective, and certainly more clinically effective as well. So Penang is, I think, as a medical tourism hub, going to be one of the leading centers in Malaysia in terms of adopting these new technologies.
All right, that is one of the most needed impact is cost effective. And what are the potential impacts also on the single specialty hospital model on the broader healthcare system in Malaysia, especially particularly regarding resource allocations and interdisciplinary of collaboration?
Thank you for that question, because I think Northern Heart Hospital is the first single specialty cardiac and vascular hospital outside of the Klang Valley. I mean, you've got IGN, CBSKL in KL, but Northern Heart's the first one outside of the Klang Valley. And single specialty is already something that is more commonplace in the US, Europe, and others. But the advantage of single specialty is, maybe if I can take the analogy of somebody who has, let's say, a Volvo, right? And you take it to a mechanic who understands a Volvo, looks at a Volvo day in, day out. So single specialty is the hospital where the doctors, the staff, the technology, the allied health staff are basically looking at one particular area of specialty day in, day out. And they become very used to picking up symptoms, making sure that things are done properly for the betterment of the patient and the outcome of the patient. So we do believe that single specialty centers are increasing in Malaysia. It's probably complementary, and I'm not saying that multi-disciplinary hospitals don't have a role. I think it's complementary. Both have a role to play, but single specialty gives the advantage of bringing people together where they are specialized into a particular specialty like cardiovascular, and trying and increasing the outcomes and improving the outcomes and working together. In particular, in Northern Heart, for example, the doctors now work as a team. And the benefit is, instead of a patient seeing a doctor who's got maybe 15, 20 years of experience, you're meeting a team of doctors who collectively have 80, 100 years of experience. And because of that, the patient benefits from being part of that single specialty clinical partnership model that hospitals like Northern Heart are trying to create.
And we can see that within the healthcare sector, among also across every other sector, is facing one of the challenges is cost. And definitely one of these initiative efforts is for our aim is to get cost effective is one of the solution that we are aiming for. So how can Malaysia develop a comprehensive policy framework to manage the rising costs of healthcare while incentivizing innovation and maintaining high quality patients' outcomes?
I think there are a couple of things. One is obviously the government is now quite actively pushing for public-private partnership. And with that, what happens is equipment, including manpower, is better utilized rather than having equipment in the private sector that's underutilized. So alhamdulillah, the government through PH Corp is now quite actively pursuing the public-private partnership model. And with that, the cost. So when equipment is better utilized, obviously the cost can come down. So that's one. Number two, I think rightly the government, the federal government, both as well in Penang, is also pushing for investment in medical devices. Your viewers may or not know, but Penang actually has got significant investment in medical devices from Boston Scientific, Medtronic, B-Broad. So if you go to Penang, you see these large factories. And we're proud to say that, for example, in Northern Heart, the stents that we'll be using for patients when we implant them are produced in Penang. And this is a global facility. So that's something to be proud of for Malaysia and for Penang, that we've got facilities like this which are being built. And I think that's because of the incentives provided by the government. So we do urge the government to continue encouraging these investments. And with that, the cost can somewhat come down, although these are MNCs and they're still governed by global prices. But the logistic costs and all that, we can negotiate and try and bring down those costs for high quality devices still being used in Malaysia. And lastly, I think increased competition to a certain extent in the private sector, but also making sure that we have the right specialists and the right number of specialists. The government also, I think, is trying to bring in or facilitate for Malaysians to come back from overseas, Malaysians who have been trained and working in Europe, in UK, in Singapore, to come back and with more specialists, with greater access. This is something that can also help us to manage the cost of healthcare moving forward.
All right, Mr. Anwar, I must say thank you very much for this insightful sharing. And definitely after this, our discussion, maybe we could also dive deep on the role of the global economic trends and geopolitical factors that play in influencing the cost dynamics and of healthcare in Malaysia, and also look and identify which can the countries, we can say implementations, or we can say strategies on planning, implementing strategies, navigating through all of this factor. And again, I want to say thank you very much to Mr. Anwar Anis, the Executive Director of Northern Heart Hospital, and definitely all of our discussion here will be featured in AstroAWANI.com and across all social media platforms.